from the San Francisco Bay Area.
Oh, hi. What's your question?
My dad recently had a health scare where he was on vacation at high altitude, and he experienced shortness of breath, excessive coughing, blood in his phlegm, and feeling tired. In a hospital, a doctor at the hospital took his blood work and diagnosed him as having a heart attack. And after more blood work, like a day later, a CT scan and further assessment, they said he just had pneumonia, and they said it was not a heart attack. But I wish we could have avoided the harmful effects of the CT scan and just got the diagnosis of pneumonia first. So my question is, how can you diagnose cardiovascular disease in a safe way without resorting to a CT scan or angiogram? Basically, what's the ideal way to diagnose cardiovascular disease?
Yeah, Dr. Peat.
I think the first thing a person notices is that they're having trouble doing their usual energetic activities. There's something going wrong with their circulatory system.
And then would you be thinking along the lines, I mean, the typical model would be stress-induced pain, exercise-induced pain, for angina, for sure, and in terms of functional, stable or unstable angina. Yeah, I find that kind of strange that they would put down to the event as a heart attack. There are certain enzymes that are leaked by cardiac muscle in response to that ischemia that's the result of heart attack. So how reliable do you think those enzymes are as a marker?
Somewhat, but I wouldn't trust them in myself.
Okay.
There are a couple types of enzyme. One is a particular heart protein.
Right.
You can trust that. But just stress and exertion, the same way that you can damage a muscle by running too far or too fast uphill or such, overexertion. And so if your energy supply is low, if you're hypoglycemic and running on fat and stored energy, exertion can damage any muscle, including your heart muscle, just by extreme overexertion. So if it's just somewhat borderline evidence of a heart attack, you wouldn't necessarily do anything more than take good care of yourself.
And I know I want to ask you this question for myself. I'm just curious as to your response. But one of the first things that they'll want to do, I imagine, I'm not a medical doctor, but I imagine they'll want to do a examination of the vasculature of the heart and inject dyes and give you an angiogram. And what do you think about the components of the dye and or any risk associated with angiograms?
If you're not sure that your heart has been slightly injured just because you have a slightly different feeling, when you get a chemical injected into your heart, and then especially if you exercise with that chemical in your heart, the chemical itself is going to irritate things and cause some damage. So it isn't an entirely free and safe thing to do. You have to really suspect that there's something to look for, and then what are you going to do if you find it?
Right.